this is a video for donning and doffing enhanced PPE for airborne precaution at NRGH, required only for the aerosol generating medical procedures of intubation, extubation, and open airway procedures. All donning and doffing procedures require a trained observer and a reader to ensure appropriate steps are followed. The most likely step for self-contamination is doffing. Therefore, do it slowly and deliberately. Make sure your partner is doing it well. We all have a critical role to play in ensuring each other's safety.
Step 1. Remove all jewelry, IDs, and cell phones. Perform hand hygiene. Hand hygiene is to be performed for 20 seconds, but for the purposes of this video, it is shortened. Step 2. Shoe protection. Rubber boots or shoes that can easily be wiped down is recommended. Otherwise, you can use shoe or boot coverings. Note, these are a known source of contamination with doffing process, and should you choose to use them. Perform hand hygiene. Step 3. Put on a hat, ensuring ears and hair are fully covered. Perform hand hygiene. Step 4. Put on N95. Remove your glasses first. Spread open the mask so that it covers the nose, mouth, and chin. Place the bottom strap below the ears and the top strap over the crown of the head. Using your hand, push down on the mask to ensure a seal. Do not push or pinch the wire part across the nose. This will create a leak. Perform a positive seal check. Blow out. You should not feel any air from the top or bottom of the mask. A bit of warmth radiating out of the mask is fine. Perform a negative seal check. Draw a big breath in and have your observer confirm that the mask sucks in. Replace your glasses. Step 5, put on hood. Take the ends and cross over to cover the neck. Then tie the back of the hood. The observer should ensure the neck is not exposed.
The surgical team can don their face shield and scrub at this step.
Step 6, put on nitrile extended cuff inner gloves. Step 7, put on gown. Secure the Velcro at the neck and tie at the waist, ensuring the tie is off to the side so that it is easier to doff. The observer should ensure the back is fully covered. Step 8, put on face shield. Step 9, put on outer gloves. Ensure the cuff of the gown is covered. You have now put on the correct attire for aerosol generating medical procedures of intubation, extubation, and open airway procedures. Doffing. This video is made with an anteroom available. If no anteroom, doffing can take place at least 2 meters away from the patient. Please consult with infection control and specific unit for advice. Step 1. Before exiting the patient room, decontaminate the outer glove with Percept wipes. Dispose these wipes inside the patient room into biohazardous waste. Use a new Percept wipe to open the door to the anteroom and dispose these wipes in the biohazardous waste in the anteroom. Step 2. For waterproof shoe wear, you can wipe them down with Percept wipes at this stage. If you have shoe coverings on, be very cautious to minimize self-contamination and follow the following steps. With your gloves still on, grasp each side of the booty. Lift the heel to clear the booty from underneath. Lift the toes to pull the booty away from the foot. Discard in the biohazardous waste. Decontaminate the outer glove with Percept wipes. Repeat these steps to remove the second booty. And decontaminate the outer glove with Percept wipes again. Step 3. Remove the outer glove of the first hand by pinching the glove just above the palm area. Peel the glove from the hand and turn the glove inside out. Keep the removed glove in the opposite hand and do not discard yet. Remove the outer glove of the second hand by inserting the index finger under the top of the glove. Discard both gloves in the biohazardous waste. Decontaminate the inner gloves with Percept wipes and discard in biohazardous waste. Step 4. Untie the side of the gown. Pinch the gown at the shoulders and gently pull away from the body to loosen the back Velcro. Slowly pull the gown away from the neck and shoulders, touching only the outside of the gown. With one hand, grasp the cuff and glove of the opposite hand and pull the hand into the sleeve. With the hand inside the sleeve, grasp the glove and the cuff of the other sleeve and pull the hand inside so that both hands are now tucked inside the sleeves. Lean forward and roll the gown off the arms, turning it inside out. The inner gloves are tucked inside the gown as you remove it. Perform hand hygiene with the alcohol-based hand sanitizer. Step 5. Place new gloves on that your spotter will provide you before removing the face shield. Caution, do not touch the outside of the face shield. Hold on to the elastic band, tilt the chin up to minimize self-contamination, and remove from the face and discard in the biohazardous waste. Perform hand hygiene. Remove the gloves and perform hand hygiene again. Step 6. Undo hood tie. Hold the ties out at full length and grasp both ties in one hand. While holding both ties, use the other hand to pinch the top of the hood, lean forwards, and remove into biohazardous waste. Perform hand hygiene. Step 7. Remove the N95 mask. Take off your glasses and pull the bottom strap over your head using both hands. Then hold that strap with one hand. Using your free hand, pull off the top strap and hat together while leaning forwards. Discard into biohazardous waste. Perform hand hygiene. Wipe your glasses with Percept wipes and perform hand hygiene. Step 8, use a paper towel to open the door and exit the anteroom. Discard this paper towel in biohazardous waste and perform hand hygiene. Step 9, take off scrubs, shower, and put on a new pair of scrubs.